Now, imagine if your stomach was filled with worms, if your limbs swelled so much you couldn't walk, or if your eyelids turned inward. These are just some of the symptoms of neglected tropical diseases. They're called neglected because they affect the world's poorest and receive less attention than other diseases, causing unspeakable agony for nearly 2 billion people, 40% of whom live in Africa. Sadly, Nigeria ranks second amongst the high-burdened countries for neglected tropical diseases after India. So many people disfigured, debilitated, or killed by these 20 deadly diseases, with at least 14 of them endemic to Nigeria. They include leprosy, elephantiasis, and trachoma, which are all preventable diseases. But with cuts in foreign aid from Western countries, the World Health Organization is warning that it's leaving millions of the world's poorest people at risk from these so-called neglected tropical diseases. Well, for more on this, I'm joined now in the studio by the Executive Director of Uniting to Combat Neglected Tropical Diseases, Thoko Elphick-Pooley, who's working with other national and global agencies to try to end neglected tropical diseases. Thank you so much for coming in.
Thank you for having me.
Just tell us more, first of all, about these neglected diseases and why we should be concerned about them.
Excellent. Thank you for giving me this opportunity to come and talk about these diseases today. Most people walking on the streets of Nigeria probably have seen somebody sitting around the streets with a swollen limb by the side of the road, probably begging. Or they have seen someone with leprosy, which is one of the more common neglected tropical disease. But they've never actually thought what these diseases are collectively or what is the cause of them. So these are ancient diseases, horrific diseases that really do not have any place in the 21st century, but they affect the most poorest people, as you said earlier in the opening of your program. They are ancient diseases. They really cause a lot of suffering, and we need to end them.
Yes, I mean, we're looking at videos of some of them. I think the word you used is most appropriate, absolutely horrendous. And globally, almost 2 billion people, I understand, are affected, many of them in Africa, Nigeria ranking very high indeed. Apparently, out of the 20 diseases classified by the WHO, 14 of those neglected diseases are in Nigeria. That's fairly alarming, isn't it?
Totally. I know Nigeria likes to be first in everything, likes to be first on the continent, but this is not one of the areas where you want to be first in. Being second on the continent, in the world. Yeah,
that's scary. That's after India,
That
isn't
is
it?
terrifying.
Yeah.
And if you look at the numbers, according to the Minister of Health in Nigeria, over 120 million Nigerians are at risk of these diseases. The population of Nigeria is 206 million. So if you do the sums, that's over half the population of Nigerians at risk of these diseases. That's pretty horrendous.
That is very, very worrying indeed. So why are these tropical diseases neglected, and why do they receive far less attention than more well-known diseases, for example, malaria?
I would actually say that the diseases in themselves are not neglected, but it's the people that suffer from them that they are. Because these are people that you find in the rural areas, in hard-to-reach communities. They're not visible to people living in the cities. So these are individuals that are really neglected. And I'm not sure whether, because if you think about these are preventable diseases, diseases that we can get rid of, diseases that deliver some of the best wins in public health, and yet little funding goes to them. So I consider this a neglect of poor people on the planet. So really, let's not think about them as, yes, we call them neglected tropical diseases, but these are really neglected people.
That's a very important distinction there. But a lot of attention has been focused in the last few years, though. I mean, the WHO has held these global conferences. The UK and a lot of these other countries have tried to focus attention on this.
But with limited attention span. So if you look at it within the UK, as you alluded to earlier, the UK government used to be a fantastic supporter of these programs, committed to using its international aid to help the poorest people on the planet. Now, you cannot find an area in global development which represents doing good for the poorest people, such as the neglected tropical diseases, and yet the UK government has turned away. Why? That's a conversation for another day.
Well, actually, it's a conversation for today, because
well,
an important
let's
aspect of the reason why the UK government has not so much turned away, but reduced the amount of money it's been budgeting for this kind of thing is quite simply because of the ravaging effects of COVID-19.
Well, you can say that, but really to take money away from the poorest people during a pandemic, there can be no justification for that. People have suffered the worst during COVID-19. The poorest people have suffered the worst. If you think about some of the measures that were implemented during COVID-19, they involved staying at home, self-isolating, not going to public places. Now the economy of Africa is largely driven by people leaving their home, going to the market, working, producing, feeding their family. So now if you're going to take away a lifeline during a crisis when people have been most affected, then I'm not really sure that there is a single individual on the planet who would agree that this is a sound and good idea.
But is it the responsibility of the British government or Western governments, or is it the responsibility of the individual countries where these diseases are occurring?
This is why we're here, because actually the UK, these are infectious diseases first of all. They represent what we call a global public good. Because they're infectious, they don't respect borders. If one country is affected, a neighbor is also affected. These are diseases that require collective efforts by donors, by the private sector, by the countries. We're actually here in Nigeria this week to talk about the leadership role of Nigeria in fighting these diseases. This isn't about one partner stepping away so that somebody steps in. This is about everybody working for the collective.
Right. Concerted action.
Collective action. This is what this is about.
The point, of course, is that at some point, Africa has to take responsibility for itself, doesn't it?
As an African, I completely agree. Because the Africa that we want to project as African people isn't one where children have worms emerging out of their legs, where a child is full of worms to the point they can't go to school. They can't absorb the little nutrition that they get. This is not the Africa we want. The Africa we want is a thriving, happy, joyful, where everybody is given an equal chance in life, free of preventable diseases. Yes, we really are calling on countries to step up, take action, put more money on the table to make sure that they're working for the poorest. But we're also calling for partners that have been supporting these diseases to stay on board. Don't walk away now, especially during a pandemic.
And I mean, talking about these diseases, I mean, let's just get a better sense. I mean, people have a greater visual sense, for example, of elephantiasis and all the rest of it, leprosy and so on and so forth. But there are also complications linked to attacks from things like snake bites, aren't there? I mean, what's the best way to deal with something like that? Is that simple education, making people wear things like rubber gloves and rubber boots and that sort of thing?
Well, it's actually a tragedy that people get injured or die during a time when they are being productive, when they are farming, when they are out harvesting. So little grandma goes out to bring some grain, gets bitten by a snake. The problem, where does she go for treatment? So one, there is awareness and education required so that when the grandma is bitten by a snake, she knows what snake has bitten her, because that's the first line of treatment. So awareness, because we have in my language, a snake is called inyoga. So if you say, what's bitten you?
You're from Zimbabwe.
I'm from Zimbabwe.
Right.
And you say, I've been bitten by inyoga, but identifying the snake is actually a first line to support with treatment, because you can be treated better. But secondly, is the referral system that exists, someone being able to get care near where they live. Because actually, with a snake bite, the window of intervention is so limited.
Absolutely.
So we are calling on that chain and referral system to be in place to ensure that communities can receive support at all levels of care. But also greater investments are needed in antivenoms. So this is something that researchers in R&D, such as the Liverpool School of TropMed, working with research institutions on the African continent, are looking to develop better antivenoms. So this is a really important area in order to save lives.
We've got about a minute or so, I believe, before we have to take a break. I mean, beyond snake bites, how do you fight these neglected tropical diseases? Obviously, you need medicines and things, but I mean, things like improving water and sanitation, they're all part of it, aren't they?
Totally. I couldn't agree with you more. The best line of intervention is prevention. A lot of these diseases are caused by absolutely shocking standards of living, where communities don't have even the most basic access to clean water and sanitation. Take trachoma, for example, caused by a bacterial infection. You need to wash the face, you need a clean environment. But where you have communities living in close contact with animals, there are flies everywhere, no clean toilet, it's just a recipe for disaster. So we need those investments in water and sanitation to give communities a chance to prevent these diseases from occurring.
I have to say it's a big question for domestic governments. I mean, they've got to take considerable responsibility. But stay with us, because it's absolutely fascinating talking with you, and would like to talk with you a bit more. You're watching the Arise interview. Plenty more still ahead as we continue our chat about attempts to eradicate 20 neglected tropical diseases in the face of the challenge of funding cuts. Stay with us. Welcome back to the Arise interview. I'm Charles Anyegulu. My first guest today is the Executive Director of Uniting to Combat Neglected Tropical Diseases, Thoko Elphick-Pooley, who's working with other national and global agencies to try to eradicate these so-called neglected tropical diseases. They are, of course, considered to be neglected because they affect the world's poorest and receive less attention than other diseases. And they are tropical because they occur in places like Africa and parts of Asia. There are about 20 of these devastating ailments, and at least 14 of them occur in Nigeria, including elephantiasis, leprosy, trachoma. Thankfully, with international support, the country managed to eliminate guinea worm. But now, with the foreign aid budgets of Western countries being cut, millions more are at risk from these preventable diseases that kill, blind, maim, and disfigure their victims. And the Executive Director of Uniting to Combat Neglected Tropical Diseases, Thoko Elphick-Pooley, is still with me in the studio. Thank you for staying with us.
Thank you very much.
So tell us more about what you're doing here in Nigeria. Presumably it's related to your work on fighting neglected tropical diseases.
Absolutely. So we are here to drum up support for countries to take greater political leadership in fighting these neglected tropical diseases. And this is why. The World Health Organization, in its new NTD roadmap, has incredible ambitious targets to eradicate 2 diseases and to eliminate at least 1 NTD in 100 countries. Now think about this. If we are going to be standing in 2030 celebrating the eradication of diseases, who do you want forefront saying, I did this in Nigeria? Surely you want the leaders to be forefront saying, we did this for our citizens. You don't want donors standing in Nigeria and telling Nigerian people that this is what they did for Nigerians. That would be a tragedy. So we are here to say to countries, look, we have a moment in history to make significant changes in disease eradication and elimination.
And that presumes that they're not doing what you expected them to do.
Not as much. They're really trying hard. We've had a really good and productive meeting with the Minister of Health here in Nigeria. He's very committed to these diseases. He has a whole team in place. He has an NTD coordinator. They have a master plan. They're really working hard. But really, they need the budget. They need the funding to be able to do what's needed. So far, we don't have enough budget allocation to actually do what's necessary in Nigeria to end this disease.
Right, but based on what you've seen so far and your assessment, has Nigeria made good progress in fighting these neglected diseases, or is it sort of trudging along?
Nigeria has eliminated guinea worm disease. I met Honorable Member House Representative Dr. Sununu the other day, and he said to me, in his family, he is the only person who never had guinea worm. Everybody had guinea worm. Everybody knew guinea worm. But if you go to the communities now, young people that are growing up today don't know what guinea worm is. That's fantastic. So Nigeria has already shown that disease elimination is possible in one disease. Now we're waiting for other countries to eliminate in order to achieve eradication, because eradication can only be achieved if the disease has been eliminated everywhere.
Right.
So Nigeria has an opportunity with other areas. It's made huge progress on river blindness. It's making good progress on trachoma. But progress in fighting infectious diseases needs to be sustained.
Absolutely.
It can't just be you do well today and tomorrow you turn off the lights.
So given what you're saying there, what sort of targets are you setting for the eradication of these so-called NTDs, and how ambitious are they and how realistic are they?
So far, 43 countries have eliminated an NTD. These are countries like Togo, your neighbors. Togo has, and Togo is actually about to hit a hat trick of elimination. You have countries like Malawi that have achieved elimination. I know my Nigerian friends, if you start showing them the scorecard of countries that have eliminated a disease, they say, where is Nigeria in this? Nigeria should be here. Nigeria takes pride in so many places. And I know for Nigerian citizens, they're actually shocked that Nigeria is in top of the leaderboard. So we don't want Nigeria to be top of the leaderboard in terms of burden. We want Nigeria to be top of the leaderboard in terms of elimination, and it's possible.
Right. And there is a global campaign due to kick off in the new year, isn't there?
That's correct. And that campaign is going to be called 100% Committed. We want countries to sign up. We want countries to say they're 100% committed to ending neglected tropical diseases, but not just in word, but to put in place measures to set up a Nigeria task force made up of government, senators, legislators, governors, ministers, private philanthropists, corporates, coming together and saying, we are Nigeria. We are 100% committed to ending NTDs. And everybody saying, this is what I'm bringing to the table. This is what I'm putting to the table. And only through that can we achieve elimination of NTDs in Nigeria.
Wow, I'm inspired listening to you here. I mean, from a personal point of view, you are not just the executive director of Uniting to Combat Neglected Tropical Diseases. I understand you're also the co-chair of the G7 Task Force on Global Health. What drew you to sort of focus on NTDs?
Well, this is the tragedy of it. I traveled to Kenya once, and I met these, Kenyan Maasai women and Samburus, all beautiful, wearing lovely necklaces. And I met women that were wearing beautiful necklaces, at the end of which they had tweezers. And they were carrying those tweezers, wearing them around, so that they could pluck their eyelashes from the pain of the eyelashes turning inwards to trachoma. And I found these women that were accepting pain as part of day-to-day living, coming up with rudimentary instruments, rusty old pieces of metal, so that they could pluck their eyelashes. And they'd accepted pain as part of day-to-day living. And yet they could prevent these diseases, they could get treatment. So I'm really passionate about how we can see an end to these diseases for the women, for the young girls that are currently suffering from these diseases. And if we can collectively agree that this is what we can do as humankind, let's do it.
Well, we appreciate the strength of your conviction. Thank you very much indeed for coming in.
It's a pleasure.
The Executive Director of Uniting to Combat Neglected Tropical Diseases, Thoko Elphick-Pooley.